Welcome to our e-class. In the last session, you have already been taught about malaria, its causative agent, the life cycle of the parasite in detail, and the clinical features and pathogenesis of the disease. Today, our main aim of lecture or teaching is to tell you something about the complications or the life-threatening conditions that may involve the process of the disease, and also we will be discussing a lot about the laboratory diagnosis. Pernicious malaria. What is it? It is a complex of life-threatening conditions that may supervene in a case of acute falciparum malaria. It is of three types: cerebral, algid and septicemic. What is cerebral malaria? In cerebral malaria, the internal capillaries of the brain are plugged with parasitized RBCs. There is pigment in these RBCs. The patient usually presents with hyperpyrexia. There is paralysis, there may be coma, and ultimately death ensues. It is commoner in children in hollow endemic areas. Algid malaria, the patient presents with features of dehydration. There is vomiting, there is diarrhea, there is cold clammy skin, and here also death may ensue. And septicemic malaria is a patient presents with severe prostration, and what happens? There is also chance of multi-organ involvement. So these are the features or the conditions that may supervene an acute attack of falciparum malaria and which are really fatal in their consequences. So you must keep in mind while diagnosing or treating a case of malaria. Black water fever. What is this? Quinine is a drug that was used previously, not used nowadays that much, for the treatment of malaria. In cases that were partially treated with quinine or patients with reinfections, these patients used to present with this condition. What happened? The parasitized RBCs or the RBCs loaded with quinine, they used to act as antigens. So when these patients were treated with quinine in the subsequent infection, the antibodies used to be formed against this antigen and there was massive destruction of RBCs. So massive destruction of RBCs followed with repeated administration of quinine in such cases. So this has become rare nowadays because we do not usually treat with quinine these days.